Celia Dalton is a mammography and bone density technologist at the Betty Pushkar Breast Care Center. She and her husband John have been married 5 years. Celia remembers when John began to show pneumonia symptoms 2 years ago. She convinced him to go see a doctor, but they were shocked when they found out John had lung cancer.
He showed us the CAT scan, and being an x-ray tech, I knew exactly what that was, and John was totally oblivious and just wondered what that thing was. It looked like a spider, and so Dr. Parker said, you need to go see a surgeon.
John has worked in coal mining for 31 years, and he also smokes. Celia says the mining may be the culprit based on the type of lung cancer found in John.
Always think it's smoking when a person smokes. You always think that. The type of lung cancer that he had was an adenocarcinoma, and it was called non-small cell. And non-small cell does not necessarily come from smoking.
Smoking is the usual suspect when it comes to lung cancer and death rates. West Virginia's elevated smoking and lung cancer incidence rates bear witness to this. Recent research suggests coal mining may play a larger role than what those in the medical field once thought. Dr. Michael Hendricks has done research that reveals the Appalachian region is affected more than other areas of the country where heavy coal mining takes place.
There are several possible explanations. One of them is differences in population density, that more people live closer to mining activity in Appalachia compared to mining in other parts of the country, so the exposure levels are higher.
The Centers for Disease Control and Prevention data shows that West Virginians are almost 1.5 times more likely to get lung cancer and die from it than the nation as a whole. Better detection and treatment methods could be on the way. Potentially significant research is being done locally at West Virginia University. Dr. Long Guo recently completed a study that found a set of genes that could help doctors detect the possibility of lung cancer recurrence in patients.
It's very hard to physicians to tell which tumor is more aggressive, specifically which patient would have the cancer come back within 5 years after the surgery. So that's a major motivation of the study.
Dr. Guo says this research could lead to more advancements in early detection and better treatment options. What could all of this mean for Celia and John Dalton? John will be 2 years cancer-free in April, but Celia is looking toward the 5-year mark before she can feel relief.
We'll grow old together. That's what that means to me. I really think you passed that 5-year rate with lung, and you've done something.
Celia and John feel fortunate that John's lung cancer was detected early. Rodney Lamp, WVU News, Morgantown.